Yeah.
Now I have a pleasure to introduce Kunal. He will introduce himself, but he is the clinical pharmacist working within the practice, making a great contribution. He'll tell you about all.
Thank you, Dr. Panda. Afternoon all, as Dr. Panda said, my name is Kunal. I'm one of the clinical pharmacists that work at JS Medical Practice. Similar to Andrea, I hope today I can give you a brief overview of what clinical pharmacists can do within the practice. And as Dr. Panda said at the start, thank you for taking the time to come out, because these sessions really give us a good idea as to how we're doing as a service and where we can improve to help you guys be more aware of what we can do. So, first off, has anyone had a call from any of the clinical pharmacists so far at JS Medical? Perfect. As you know, obviously pharmacists can now work in GP surgeries, as we're doing now, as well as the community, which is the stores you get your medicines from. So within community, they've got their services to do certain types of reviews, or even give you a review when you start a new medication. And now with the introduction of us in primary care, that's our role, to give you that more in-depth review that you may not have had access to previously. So if I start with the slides, I'll be able to show you why essentially pharmacists are now in primary care. As you know, GPs are very busy, they're always booked up, multiple appointments and short slots. Whereas us as clinical pharmacists, we give patients the opportunity to sometimes have a more in-depth review because we have longer appointments. And as mentioned, we are the experts in medicine. We do a 4-year master's degree at university, learning about medication and the way it affects the body. So with our longer appointments, we maybe get to delve in a bit deeper than maybe some of the other practitioners may not get the chance to. As you maybe commonly know, the one appointment, one problem scenario, when you only have 5 or 10 minutes, that's essentially sometimes negated when you have a longer appointment with the pharmacist, which should be up to 15 to 20 minutes. And with these longer appointments, by delving in deeper, we can see a lot more. So there could be maybe underlying reasons as to why people are having certain concerns, maybe it's not even medicine related. And this is why when we have people like Andrew and social workers, we can link well with them because we work as a part of a team. So if there's something I've identified, as Dr. Pandya said, we all have our own specialities. So if there's something that I may have superficially noticed, I can then refer you on to Andrea to have a more in-depth review. In terms of the conditions we can cover, it varies. So we are experts in long-term conditions, and some of them are just listed here. But this could be your annual asthma review, your annual COPD review, hypertension, diabetes, and that's just to name a few. Clinical pharmacists, as do all practitioners, will have their own expertise, their own specialities, and their own competencies. So the more senior ones may be able to do even more and provide you with more service. But this is where we also recognize our limitations and competency within the practice. If we aren't able to go further with you, we can refer you on accordingly, either to the doctor or someone else. And this is one great thing about JS Medical Practice, I think, which Andrew has already mentioned. Our ability to work as a team and have everyone on standby is a great improvement for you guys. Because if we have to pass a query on to the doctor, we can do this straight away, have a discussion with them, and then get back to you. Not just long-term conditions, but medicine-related queries. So as you know, pharmacists typically used to work in the community, so they're the experts in the medicines there. If you have queries regarding medication, maybe with issues of it, side effects, why I get 1 month of one thing, 2 months of another thing, these are typical queries that we can deal with, which frees up the GP's time. So like I said from the previous slide, deal with more complex cases, whether that could be cancers, acute presentations, or work that's within their competency. High-risk drug monitoring and reviews. So certain medicines that patients take need more stringent monitoring, whether that be blood testing, physical checks, or actual annual reviews. Pharmacists have a very key role in this part of work because we will be making sure that annually, or 3 monthly, or 6 monthly, you are recalled to have these tests. Whether that's just a simple blood test, or then a telephone call to follow up based on your blood test results. So this is a key area that pharmacists have really had a positive impact on. And not just normal high-risk monitoring and blood tests, even when you have blood tests for your diabetes, potentially your hypertension or your cholesterol, if they come back abnormal, we are able to intervene, give you counselling, and if need be, start you on medication for it. The last point on the slide says clinical correspondence. What that means is if you are ever having any contact with either secondary care, so hospitals, or other aspects of the community, and the clinical letter is sent across from their department to ours, just to inform us of any changes, we will be the ones to action that. So whether that's changes in medication, or advice, or updates, we will read those letters and then contact you accordingly if need be, and update your medical notes. Polypharmacy. So essentially, polypharmacy is when a patient is on multiple medicines. And as we know, medications can sometimes be started a long time ago, and patients may just continue taking it out of routine as opposed to necessity. So with clinical pharmacists, as we have those longer appointment times, we can delve in to why you're taking each medication, ascertaining whether you are aware why you're taking the medicine, which is an important thing, because sometimes patients are the best information. You'll know why you're taking the medicine, and if not, this is where we can further discuss. So our aim with these type of polypharmacy reviews is to make sure if you aren't taking, or if you're taking the medicine you no longer need, we can look at the option of reducing that for you. One, that benefits yourself because that's less medicine you're taking. That could be 2 or 3 tablets or a liquid you may not need to take. And again, it helps with the NHS in terms of NHS wastage and money expenditure. And in these reviews, it gives you a chance to also mention any concerns, queries you may be having with regards to either your medicine or the condition you have. And again, that ties well with our longer appointment times. Unfortunately with GPs, because they've pushed for time, they may not be able to do that, whereas this is the opportunity that we can give you as a clinical pharmacist. As mentioned earlier, what makes us suitable for the role? We spend 4 years at university doing a master's degree in pharmacy, and we have 1 year in practice, which is now can either be within the community, within primary care at the GP, or within hospital. And that's essentially, it's like a structured internship where you're practicing as a junior pharmacist, and you have an entrance exam at the end of it to qualify to be able to be a practicing pharmacist. We also have something called the CPP pathway, so that's something I'm currently doing. It's an 18-month structured course whereby it's from an external provider that gives you training to keep you up to date on local guidelines as well as national guidelines to make sure we're keeping clinically on top of our work and improving our competencies. You can also become an independent prescriber, so that's something that I have done, is where you do a degree, well, a course after you've done your university, and it gives you the ability to prescribe medication, such as doctors as well, but within your competency and what you think is safe. So that's the key difference. Doctors are general practitioners. They have a wide knowledge across all systems. So that's why they're able to prescribe such things. Whereas pharmacists, yes, we do have a degree to that, but we could maybe specialize in a few things, which gives us the opportunity to prescribe in that, and we will recognize our limitations with what we can and can't do, and we signpost to the doctors accordingly. And the last point is just ongoing monthly training. So I'm part of a wider federation of pharmacists where there's about 15 to 20 of us. Every month we touch base and we have in-house training. Again, just for local guidelines and updates to see how we're getting on. Our team, so this is our team at Chase Medical Practice. It's a good number of pharmacists to have at a practice, and I think this is one key thing that JSM also recognised, that as a workforce we are able to help alleviate some of the pressures and provide that service to our patients. So we have Meera Shah, so she's one of our in-house pharmacists here, that's here most days of the week, and we have Linda, myself, Kay and Shivani, which were here on certain days of the week as well. And we also have a pharmacy technician, which isn't a pharmacist, but is a side part of that, which deals more with high-risk monitoring again and dealing with documents.
Maybe I'll also just stand up a little. So thank you. Yeah, actually, these are real additions, aren't they? Thank you. So I work with Andrea, and I'm actually the chief exec of an organisation called Public Voice. We're based in Haringey. We've been around for about 7 years, and what we do is we meet with different patient groups or different clients working in social care or in the health service, and we listen, basically. We're called Public Voice because we listen, and just as you're making a very valid point here, and Madame, you also did, things that didn't work well, or the things that are working well, like social prescribing. We want to hear those views, and we want to feed them back to the relevant health services or the social care services. So we run Healthwatch Haringey. I'm going to distribute these. I don't know if these are any use to you. I hope they're the right size. But it has our number on it, you see, which is why I'm giving it to you. Maybe you'll pass them round. Healthwatch Haringey, it's funded by Public Health England, and it's all about finding different ways of engaging with patients, and one of those ways is patient participation groups. Patient participation groups. This is one, isn't it?
Yeah.
And thank you very much.
Thank you.
And we are working and supporting a number of patient participation groups all across Haringey, but we don't have we are not engaged yet with any of the patients in this patient participation group. But what we've started up is like a network of PPGs, as we call them, where people can't join, and at the moment it's all online, so we have a call 2 or 3 times a year where people say, okay, this is my experience of my surgery, and these are the things that they've done well, and people say, oh, that's interesting, I'll take it back to our surgery. And or these are the things that we're all struggling with, and GP access has been massive, you know that, it's been massive. And one of the things, some surgeries have put in better telephone systems, for example. We're also trying to get people to be using the NHS app so that they can order their prescriptions online. You do